Hi, I'm Dr. Rajdeep More, consultant gastroenterologist at the Gastrocure Endoscopy Center and Liver Care Clinic in Thane. Today we'll be speaking about a very important topic, that is fatty liver. Previously it was thought that fatty liver is caused only by consumption of alcohol over a period of time, but now another entity is very commonly coming up, which is called as non-alcoholic fatty liver disease. Now, what is non-alcoholic fatty liver disease? That is the damage to the liver because of conditions such as diabetes, obesity, metabolic syndrome, and unsupervised use of some medicines which are detoxified through the liver. The prevalence of fatty liver disease, non-alcoholic fatty liver disease in India is about 10 to 30%. Now, what are the signs and symptoms of fatty liver disease? Many a times the patient come with history of pain in the right upper part of the stomach or around the stomach, right upper part of the abdomen, and sometimes patient may not be symptomatic. It is only diagnosed on routine testing. In advanced fatty liver disease, when it progresses to cirrhosis or complete damage of the liver, patient may have water in his abdomen, which is called as ascites. Patient may develop bleeding, blood and vomitus, and eventually he requires a liver transplant for treatment. So how do we diagnose a case of fatty liver disease? The routine tests such as a complete hemogram, a liver test will tell us that there is some elevation of the liver enzymes in the liver test. With the history of underlying diabetes and deranged cholesterol levels, they will be seen as deranged fasting lipid profile levels, as well as raised sugar levels in the fasting, as well as the postprandial sugar levels. Apart from the routine tests, the specialized tests for fatty liver include what we call as a fibroscan or an elastography. So an elastography is primarily a screening test. It is a specialized type of an ultrasound which takes care and which understands how much stiffness or how much damage is there to the liver. Then there is also what we call as MR elastography, and the gold standard for diagnosis of fatty liver is a liver biopsy, but a liver biopsy is not routinely done. We rely more on the tests such as a fibroscan or a sonographic liver elastography. Regarding the treatment options, the most important treatment parameter in fatty liver disease is lifestyle modification and dietary modification. It is proven in studies that moderate exercise of 30 to 45 minutes every day for 5 days out of 7 days goes a long way in mobilizing the fat as well as helping you treat with fatty liver disease. There should be calorie restriction. There should be at least 7 to 10% weight loss over a period of 6 months, and which should be maintained overall, and this has shown to reverse some cases of fatty liver disease in the early stage. Regarding pharmacotherapies, yes, we do have some medicines which are commonly used to treat fatty liver disease, but that has to be tapered according to the stage of the fatty liver disease, and that requires a consultation with your doctor. So the most important take-home message or takeaway message from this is that if fatty liver disease is not diagnosed early, and if it is not treated or preventive measures are not taken at that stage, it may further progress into liver cirrhosis and cause what we call as a liver cancer or require liver transplants. So keep healthy and have a healthy lifestyle and be fit.